Thank you, guys. All right, the following is for the endocrine preparation requirements. So, number one, endocrine system consists of both blank and their respective blanks, which travel through the circulatory system toward their target organs. Number two, the master gland is known as the blank gland, and it is composed of both the anterior blank and the posterior blank. Number three, the blank is a regulatory center and controls the pituitary gland, and hence it's above the pituitary gland. Number four, the hormones that are secreted by the anterior pituitary gland include blank, 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 and gonadotropins, which include follicle-stimulating hormone and luteinizing hormone. Number five, the posterior pituitary gland secretes oxytocin, which is responsible for the blank reflex. In addition, blank, which reduces urine production and is also known as, I gave it to you guys, vasopressin. Okay. Number six, blank, 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 and blank, and prolactin are all tropic hormones. These hormones exert their effect on the other target organs, but by themselves do not do much. So when we talk about tropic hormones, that means that it's a hormone that relays information to another gland, so that gland can secrete its own hormone, and by itself, it doesn't really do much. So just make sure you guys look up tropic hormones, and should suffice. Number seven, TSH stimulates the blank gland to release blank and blank, which influence metabolism. Blank is also secreted and decreases serum calcium levels. Number eight, behind the thyroid gland are the blank glands and secrete blank, which increases blood calcium levels. Number nine, ACTH, or adrenocorticotropic hormone, acts on the blank, which are composed of the blank, which secrete aldosterone and blank. The blank secretes catecholamines, which are stimulated by the peripheral nervous system. Number 10, growth hormone aids in growth and development. GH directly influences growth at the blank plates of the long bones, which ossify by the end of puberty. Number 11, calcium is stored in the blank. Calcitonin decreases blood calcium through means of deposition into the blank, and parathormone increases serum calcium by resorption back into the blank. Number 12, prolactin aids in milk blank, while blank helps eject milk. We're talking about hormones, right? Number 13, the pancreas plays a major role in the endocrine function by releasing blank, which decreases blood sugar levels, and blank, which increases them. Now it's the application. Number one, as TSH increases, the thyroid gland responds by blank its secretion of blank and blank when abnormally high. This is called blank. It's a condition. Number two, in Addison's disease, there is a decrease in the secretion of blank and blank, which places the patient at high risk for hypoglycemia and blank. Number three, in Cushing's syndrome, dietary modifications must be made, which include low blank and an increase in blank. Number four, blank is a condition where the adrenal medulla is secreting an excess of catecholamines, which manifests in an increase in blank. Number five, in hyperparathyroidism, serum calcium levels blank and places the patient at risk for urinary blank. Number six, hypocalcemia may result in muscular blank, which may compromise the airway. A positive blank and blank signs indicate hypocalcemic tetany is imminent. Number seven, thyroidectomy may cause some unexpected adverse effects, such as blank and blank. Patients must be monitored closely for these specific post-thyroidectomy complications. Number eight, adrenal insufficiency may cause a drop in both blank and blank. This may be induced by abruptly stopping steroid therapy, so it must be tapered off. Number nine, diabetes insipidus and SIADH, or syndrome of inappropriate antidiuretic hormone, are issues with an abnormal blank secretion. Which hormone? DI, or diabetes insipidus, manifests with blank due to lack of ADH hormone, and SIADH manifests with blank due to an abundance of ADH secretion. Number 10, Fluid volume excess in SIADH will demonstrate in urine-specific gravity that is blank and blank serum osmolality. DI includes a blank urine-specific gravity and a blank serum osmolality. Number 11, gigantism and acromegaly are both caused by an blank in growth hormone. Gigantism occurs during blank and acromegaly occurs during blank. Now, this is more about age, so make sure that you guys know that gigantism happens with an abnormal or an abundance of secretion of growth hormone during a specific age, and then acromegaly happens at a later age. So make sure you guys can differentiate the two. Number 12, hyperglycemia causes blank, blank, and polyphagia. Think of the 3 Ps. Hypoglycemic manifestations are brought upon by the activation of the blank nervous system, which includes nervousness, tachycardia, sweating, and shakiness. And then number 13, high serum glucose and ketones damage blank and blank, which leads to neuropathy and poor circulation.